We're at the first ever NHS Youth Voice Summit to capture the thoughts and ideas of some brilliant young people.
Through volunteering and social action, they're co-creating with the NHS senior leaders to help take forward a long-term plan for the NHS.
Let's hear how young people can play a key role in the co-design of NHS services and support.
I'm here to give young people a voice because at the end of the day, my generation or our generation is the future of the NHS.
I think today's a day for a lot of learning and sharing people's experiences to try and contribute something that can really transform policy implementation for the future.
Young people are really important in creating the first steps because we are the next generation.
My name is Dominic Smithers.
A lot of people here have personal experiences about their care, and a lot of them have experiences in hospitals. Now this means that the topics we're going to be facing today, a lot of them actually have first-hand experiences.
The NHS at the moment has so many vacancies, and for us it's about attracting young people into working in the NHS. They want variety, they want flexibility, and that's what we're trying to do to make sure that the NHS is a modern organisation.
Have you been to something like this before? If you have a chance to volunteer in a hospital or a community service or some other part of the health service, you get to see what people are doing and make your own mind up as to whether that might be something you'd be interested in when you grow up.
Well, I'm in medical school now, so hopefully going to work in the NHS, fingers crossed, in the future.
I want young people to know that there are more volunteering opportunities. I want delivery and service change from the NHS based around what young people have said and not what adults think.
Young people are most powerful when you tell it as it is. So the more you do that, the more the NHS and actually all parts of society will listen to you.
Just been sitting in a session about improving mental health and talking about peer support for young people with mental health problems, which I think would be really important thing to develop, which really kind of reminds us all that we need to kind of keep involving the voices of young people in the services that we deliver.
We need long-term support which realises us as human beings from different cultures and identities.
All the teachers in the staff room chatter amongst themselves, nattering about my insecurities in my forsaken mental health.
Wouldn't it be terrific to have a whole army and have some digital ambassadors who are able to say to friends of theirs about some of the work that we're doing to kind of spread awareness of what digital tools are out there.
We've had senior leaders here from the NHS who have given up their time to listen to Youth Voice.
The atmosphere has been electric, and stakeholders are really keen on getting young people involved and listening to them.
One of the things we've got to get better at is listening. So listening to young people today, telling us what you need us to do differently is part of the way that we will change the NHS for the good.
Many young people have told us what is important to them. Topics such as mental health, primary care, digital futures and working in the NHS.
It's been a really valuable experience where senior leaders have listened to the young people. As such, it's clear that this is just the beginning of more young people being supported to make a positive difference to the future of health and care.